Thank you to the Moving the Needle corporate sponsors, Home Infusion Options and Metro Infusion Center, and our exhibitors, Takeda, Janssen, and Bristol-Myers Squibb. You share our mission of advancing patient care and make events like this and our grant making possible.
So for our final session, this is very exciting because this is a new initiative for GIRF, exciting and unfortunately necessary. So as I mentioned earlier, we were all taught that at the center of all of our research should come back to a patient who's suffering or living with a disease. And in fact, the people who live with digestive illnesses are the focus and the inspiration for what we do. And unfortunately, a patient diagnosed with a high-risk type of colon cancer drove an initiative that I'm very proud that GIRF was able to step up to assist with. And that's a newer initiative called CA Cure. The CA Cure initiative was created to manage an extraordinary gift to drive research and direct clinical care to identify better ways to treat colon cancer, and in this case, metastatic colon cancer, and really forced the GI Research Foundation to take a close look at how they could do that and how they could meet the needs of patients living with these very challenging problems. And so we came up with, not unlike what you heard Jean say, campaign approach, where the organization with the leadership of their scientific advisors decides what's a priority need, and then we raise the money. In this case, some of the money came in because there was a need, and then GIRF met that need to develop a structure that would be appropriate. And without reading all the details here, the charge that we created for CA Cure to address the need of treatments and better ways to address high-risk colon cancer and other GI cancers was to pull together not just people at the University of Chicago, but really people from all over the world who can help us understand what we might need to do in order to push things forward. And through the extraordinary donation and generosity of the Chodnovsky and Rubinsky family, we were able to do so in record fashion. I'm not aware of any organization or foundation that has been able to harness the resources and the scientific expertise in the speed that we have, and to distribute over $18 million in under a year to people who could help understand and study ways to approach this. Part of developing the CA Cure initiative through GIRF was to pull together a review panel of scientists, not just from the University of Chicago and our expert genetic counselor, Christine Drogan there, but also individuals from other places who are listed here. Pashtun Kasi, a renowned oncologist from Cornell, as well as Kiran Taraga, who was here as an oncologic surgeon, is now at Yale running his program there, to review scientific proposals and help us in the fastest way possible distribute the money to a variety of recipients. You can see here a summary of the organizations that received this money. And you'll remember at the beginning of the evening, I started by saying that GIRF was started to support the work of Dr. Kersner, and then it was expanded to the section of gastroenterology, and then we expanded it to be digestive diseases. And in this case, we expanded it to wherever the best science would take us. And we thought carefully about that, and with the generosity of the donors, we're able to do so. So we couldn't invite all these recipients here tonight to tell you each what they did with the money, although we're looking forward to a future event where we'll be able to do that. But I am here to show you that we have a video summarizing what some of them are doing with their thanks to the organization. So can we play that video now?